Hello, everyone. Thank you so much for joining us for another edition of Rhodes Ahead, which is our series on thought leadership from the Rhodes community, where today I'm going to be leading a discussion on mental health and its relation to the COVID-19 pandemic. My name is Vidal Arroyo, California University 2019, and I'm a current Rhodes Scholar at Oxford, where I'm completing a master's degree in statistics. I am also currently serving as the managing director for It Gets Brighter, which is a global nonprofit organization focused on decreasing the stigma surrounding mental health issues in young adults. Today, I'm thrilled to be joined by both Doctors Joshua Chavan and Vikram Patel, who I wanted to introduce briefly before we dive into our discussion. Dr. Joshua Chavan, Ontario New College 2011, is an entrepreneur and psychologist passionate about building innovative technologies, businesses, and nonprofit initiatives globally to meet the challenges in mental health care. As a senior strategy manager for Koa Health, he is currently helping to lead a collaborative effort with Harvard Medical School to build Empower, an open access digital platform designed to train up the world's mental health workforce. He has previously worked as partnerships manager for Mindstrong Health and as a research consultant for the Canadian Mental Health Association. He has also been involved in a number of anti-stigmatization campaigns in Canada, has chaired the Mind Your Health campaign in Oxford, and is co-founder of the It Gets Brighter campaign, which shares and collects video messages for young people struggling with mental health issues. Joshua completed a DPhil in experimental psychology at the University of Oxford as both a Rhodes Scholar and a Canadian Centennial Scholar, and is an associate fellow at the Evidence-Based Practice Institute, advisor to jack.org, and an honorary senior research associate at UCL. And then in addition to Josh joining us, we're also joined by Dr. Vikram Patel, who I also wanted to briefly introduce. Dr. Vikram Patel, Indian in Worcester, 1987, is the Pershing Square Professor of Global Health in the Blavatnik Institute's Department of Global Health and Social Medicine at Harvard Medical School. He's an adjunct professor at the Public Health Foundation of India, honorary professor at the London School of Hygiene and Tropical Medicine, where he co-founded the Center for Global Mental Health in 2008, and is a co-founder of Sangath, an Indian NGO which won the MacArthur Foundation's International Prize for Creative and Effective Institutions in 2008, and the WHO Public Health Champion of India Award in 2016. He is a fellow of the UK's Academy of Medical Sciences, and has served on several WHO expert and government of India committees. His work on the burden of mental health disorders, their association with poverty and social disadvantage, and the use of community resources for the delivery of interventions for the prevention and treatment has been recognized by the Chalmers Medal, Royal Society of Tropical Medicine and Hygiene in the United Kingdom, the Sarnat Medal from the US National Academy of Medicine, an honorary doctorate from Georgetown University, the Pardis Humanitarian Award from the Brain and Behavior Research Foundation, an honorary OBE from the UK government, and the Posey Behavior Leadership Award from Austin College. He also works in the areas of child development and adolescent health. He was listed in Times Magazine's 100 Most Influential Persons of the Year in 2015. Welcome both Josh and Vikram. I'm super excited to chat with you guys. Was there anything you guys wanted to add on that, or are you guys ready to dive straight into our conversation?
Ready to dive right in. Thanks.
All right, let's go. So I actually wanted to kick off the conversation talking about Empower, which is an initiative that both of you are involved in. I really wanted to get a large scale picture of how and why did it get started. And in particular, I'm keen to hear of how both of your paths have crossed and how your prior work has influenced this initiative. I'm particularly curious of this because both of you come from different backgrounds, and with Vikram being more in academia, and Josh, your background more in business, and I'm just super curious to see what your guys' thoughts are on that. And to make it easy for all the questions moving forward, Josh, if you want to answer first, and then Vikram, you could follow up, just so it's a bit more systematic.
Sure, I'm happy to go first. And I want to say though that I'm still an academic at heart. So I did my DPhil in experimental psychology, and I still stay true to my roots in most of what I do. So everything I do,
that's fair. Thank you for that.
Evidence-based and everything. And so to your question, Vidal, I want to say that I was introduced to Vikram back in 2018 by Tom Insel, who's the former director of the National Institute of Mental Health, and also my former boss at Mindstrong. And Tom told me that a hero of his was working on this really cool global mental health initiative And when a hero of yours, as Tom is for me, wants to introduce you to a hero of his, naturally I perked up a bit. So Tom sent me an early draft of Vikram's concept note for Empower, which at the time lacked a name, but was focused on bringing together a range of technologies as part of a single digital solution to reduce the global suffering due to mental health conditions. It was hugely ambitious, but central to the proposal was the intention to use technology to train frontline carers to deliver effective psychological treatments. And what I learned looking at Vikram's work is that the proposal is built on decades worth of research that's shown you can train just about anyone to deliver mental health care and achieve impressive clinical outcomes. Basically, just as good as the outcomes as you might expect to achieve with specialist providers. And as you know, Vidal, through our work with It Gets Brighter, I've spent an awful lot of time thinking about increasing awareness of mental health challenges and destigmatizing mental health issues. But one of the consequences of raising awareness is you have to tackle with this, take on this challenge, which is once you create the demand, once you've raised awareness, what are you going to do about it? Where are you going to direct people? And what I saw with Vikram's proposal was a partial solution to this demand issue. So by helping to address the issue of limited providers, we might be able to expand access to care. And the best I could tell at that stage, no one else was doing anything like it. So I was immediately sold on the vision. And when Vikram and I finally met to discuss the concept, I just wanted to know how I could help things move along. And I got sucked in immediately. Then we probably spent 6 months or so really refining the idea and putting together a more concise pitch, which then was used to attract funding throughout 2019 and 2020.
It's phenomenal. Vikram, what would you like to add on top of that?
Well, basically what I'd like to add is that I'm so glad that I've had the opportunity to work with people like Josh, because as an academic, it has always been one of my greatest frustrations to generate knowledge that is intended to have impact at a population level at scale, but never actually does. The kinds of science that Josh is alluding to is actually not just my work, but the work of literally dozens of scientists around the world demonstrating exactly what Josh described, that brief psychological treatments, when delivered by frontline providers who don't have any prior mental health professional training, can achieve clinical and social outcomes comparable to the best care you can receive from mental health professionals. This evidence base is huge. And actually, even today, almost nobody in most parts of the world actually benefits from this knowledge. And it was very frustrating. And I realized, to be honest, that a purely scientific approach to transform mental health care wasn't sufficient. I needed to work with people who understood entrepreneurship, who understood technology, who understood business, who understood the whole process of scale up, which scientists don't have any clue about. And so I think Empower is a good example for me anyway. I'm learning all the time from people like Josh. How do scientists collaborate with with business, with technology sectors to learn how they've scaled up and apply this incredibly powerful knowledge so that far more people can benefit from it than typically what scientists actually traditionally have targeted.
Mm-hmm. My wanting to be an academic in the future, I really resonate with that frustration with the just large mounds of knowledge we have that haven't been acted upon yet. And it sounds like Empower is a really beautiful example of that happening in the mental health space. And you guys both hit on this a little bit, but I wanted to flesh this out a bit more. What do you think the unique contribution of Empower is, and in the mental health space beyond acting upon this knowledge? What ways has Empower been designed in order to really act upon that knowledge in a really unique way that's going to make a really direct impact in the lives of people?
So Vikram touched on this a little bit, Vidal, but one of the biggest challenges in mental health care is limited access to quality, affordable, evidence-based treatments. So in high-income countries, that translates to around 40 to 50% of people with a diagnosable mental health condition going untreated. And in lower middle-income countries, that number shoots up to nearly 90%. In other words, there's this colossal mental health treatment gap. And this gap, the gap between what people need and what current systems can deliver, is so great that I believe, and Vikram believes, and many in the space believe, that only a revolution in access, a digital revolution, can meaningfully address it. So we believe that part of what's required to close this gap is the development and uptake of new technologies, but in particular, solutions that can help meet the excess in demand. So this is where Empower enters. Empower is seeking to close this gap by deploying a digital learning platform to rapidly train up a workforce of frontline providers to deliver evidence-based treatments in psychological, or rather psychological treatments that are evidence-based in areas around the world, especially those that are under-resourced and lack access to treatments currently.
Just to add to that, I think you might wonder, well, what's the big deal here? I mean, online learning is, as well, especially in the last year, has become routine. Here's the difference. The difference is simply this: every single project, scientific project that has evaluated brief psychological treatments has done so in the old-fashioned format of the expert in a classroom, in a workshop, with a very select number of providers who are then trained to deliver the intervention in the context of for example, a randomized controlled trial or a small-scale pilot project. And then the quality assurance is also done in exactly the same way. The expert, often a mental health professional, often from a university background, therefore completely non-scalable, then does the quality assurance. This is not the way the real world's ever going to work. This is not the way you're ever going to scale up what is intended to be actually a low-cost intervention. Yet you've got this incredible high cost of the expert and the in-person. So what we're simply doing in Empower, and it is a very simple idea, and that's what makes it so beautiful. The simplicity is the fact that we're using a well-established platform of learning and supervision, but applying it specifically to the mental health sector, and then creating new methods on how you can take curricula and digitize them with a focus on competencies, and then following this with, well, I think one of the other innovations that the global mental health sector has developed is the idea of peer supervision, which is say you don't need the expert. If you have sufficient numbers of frontline workers who are competent, they can supervise each other for quality assurance with the same degree of accuracy as an expert. And so applying the twin ideas of digital learning and supervision with peer supervision as the modality for quality assurance, and bringing that together all together on a digital platform.
That's really beautiful. One of my favorite books reading in college was called Pedagogy of the Oppressed by Paulo Freire, and he talks about this idea of a student teacher, where all of us are able to teach each other, but also able to learn from one another. And it sounds like you guys are really bringing that paradigm directly into the structure of how you guys have been designed Empower, which is really, really cool. Moving forward, I'm curious of what are your guys' next steps with Empower?
So I think immediately we're finalizing the website, hoping to get that over the next couple of months, and then aiming to launch our first training program by the summer in parts of northern Texas and also in Madhya Pradesh and India. But in addition, we're working to, and this is a longer term vision of ours, we're beginning to work with the Wellbeing Trust to think about how we can effectively scale up our work across the US. So that means thinking about systems and what needs to change at all levels. So policy, healthcare, regulation, the level of the community, and so on, in order to enable Empower to take root and maximize our impact. And then in parallel to that work, I've recently received funding from Schmidt Futures to think about how we can bring together some of the digital apps we're creating at a company I'm working for now, Koa Health, to support both Empower trained providers and help manage burnout, and also the individuals receiving care to provide a continuity of care. And this is just one type of digital app that could be used called Foundations, which supports general well-being and helping individuals manage stress. But Vikram's initial vision actually involved bringing on board a whole variety of tools to provide that continuity of care to the patient, but also to support the people who are effectively giving out that care.
Yeah, maybe just to amplify some of those points. First of all, after the foundational skills, which of course is a very important aspect of delivering psychological treatments, these are not specific to any mental health issue. They're actually foundational skills that are provider-based skills to make sure that you can engage the individual who needs help, and is then a foundation for the treatments the specific treatments for specific mental health conditions. So soon after the foundational skills, we will be launching our brief treatment for depression, which is of course the program of the psychological treatment that we developed that Josh referred to earlier. In parallel, we're working with colleagues in University College London, led by Peter Fonagy, to develop the curriculum for a completely different kind of mental health intervention, which is parenting interventions to promote the development of very young children, which we now know is one of the most powerful preventative interventions that, as it were, strengthens the cognitive capabilities of children and then young adults to actually withstand some of the stresses they will face as they grow older, and therefore protect them from mental ill health. We're also, as Josh mentioned, with the Wellbeing Trust, exploring broader self-help, mental health promotion curricula. So that's the first thing to say. In our intervention selections, we have 3 different kinds of interventions that we intend to develop and hopefully roll out by next year. But the other thing that I'm sure some of your listeners must have caught and wondered about is he mentioned the US and India simultaneously. And to me, this is another really exciting thing about Empower, which is that we're not just doing work in one particular resource context. We think every country has underperformed when it comes to mental health care. All countries are developing actually when it comes to mental health, and therefore the same solutions should be applied in every resource context. Obviously there'll be contextual adaptation, but there's no reason for us to think that this is only a solution for example, an Asian or an African country. And finally, I wanted to say one more thing, Vidal. You know, when the word digital mental health is used, a long time ago, when the digital revolution began in mental health, this is maybe even 2 decades ago, the same barrier that Empower is seeking to address was the barrier that revolution sought to address. And what was the barrier? The lack of skilled providers. And in order to overcome that barrier, what the first wave of digital mental health innovators focused on was taking psychological science-based interventions and transforming them into apps that people could use directly. You didn't need a provider at all. But we now know 20 years later that unfortunately that idea has not achieved great traction in most populations, because it turns out that when most people are struggling with their mental health, the last thing they want to do is to sit with their phone and figure out how to fix their minds. If you give them an option of a provider who is trained to deliver psychological treatment, then the apps become additional tools, much like what I think Josh spoke about. It doesn't replace the provider, it becomes an additional tool to strengthen the provider. And that is what Empower is seeking to do, to build a provider base who can then use apps to actually support patient care.
That's phenomenal. I mean, I think the idea of using technology to increase human interaction, or surrounding these issues instead of decreasing it is hugely powerful. And, your remark about, India and US, implementing Empower in parallel is actually a great segue to the next part of the conversation I want to take us, because, we know that, Empower is doing really, really exciting things in the mental health space. But we know that, just as in large, the last year has been really tough for a lot of people in terms of mental health surrounding the pandemic. And so I wanted to start off this conversation by just asking you both, how has COVID-19 impacted our mental health and why? What is it about lockdowns and everything surrounding it that has really made it tough for us, with mental health?
Yeah, so Vidal, I think there's no one answer to that question, since everyone is different and the pandemic has impacted us all in different ways. So for some, it's the social upheaval. It's the isolation that comes with lockdowns and physical distancing. And if you're alone or living alone, the impact of limited socialization, it can be particularly severe. For others, it's the economic stress. It's the impact of losing their job or being on furlough for an indefinite period of time. And for yet others, it may be the impact of having had the virus itself. So what we're starting to see is that increased mental health issues may be linked to having had the virus, with something like 1 in 5 who've contracted COVID going on to develop a mental illness within 90 days. And for many, it's just the ongoing uncertainty of everything that's taking a toll. So the ways in which COVID is impacting on our mental health is multifaceted. But what it's meant is that many countries, we're starting to see alarming rises in symptoms and presentation. I'll just take the UK and US, and maybe Vikram can comment more globally, but in the UK and US, symptoms of anxiety and depressive disorders have gone up nearly threefold. So we're talking about before the pandemic, 11% of the population at any one time presenting with symptoms of anxiety or depressive disorders. Now it's over 30% and perhaps as high as 37% by some reports. And things are particularly worrying among young adults, where this number rises to an unbelievable level of something like 57%, according to some results that come out of the Kaiser Foundation reporting. And there was even a New York Times article recently that suggested nearly a quarter of young adults have seriously thought about suicide in the US. But of course, you might say, well, that's just symptoms. It's not the same as meeting diagnostic criteria for a disorder. But we're starting to see early indications that it's not just symptoms. In the UK, before COVID, we saw that 27% of young adult females met criteria. And now we're seeing that this number has increased to something like 40%. So all to say, the situation is so dire and something needs to be done to address this growing concern.
Yeah, well, I want to just amplify the point about disparities. I think the picture of, there's obviously variations across different countries on the impact that the pandemic's had on people's mental health, in large part because, of course, the pandemic itself has had hugely variable trajectories in different countries. So time will tell us the extent to which the nature of the pandemic itself is correlated with the mental health burden that you see in populations. But what is for certain in all populations is that this impact has not been evenly distributed across the population. And Josh alluded to some of those disparities, but I want to emphasize the most important one, which is young people. Young people in almost every single context and population which has been studied have suffered disproportionately worse than any other age group. In the US, for example, you can actually see a absolute correlation from each age segment to the next, such that the youngest age segments have the highest rates of mental health difficulties and the oldest have the lowest, which is completely contrary to what you might have expected to some extent, because we were told it's the elderly who are going to be suffering the most because of loneliness, because of the need to be physically distanced and isolated, and because they are the most risk group of the infection. You see a complete inversion. And I think that requires interrogation, and maybe we can talk about that later. But essentially, young people, the second big group, particularly in developing countries, is women. Because women, of course, have found themselves at home, having now to deal only with their remote work responsibilities, but with their kids at home because schools are shut. In very many patriarchal societies, it isn't the case that that their male partner will suddenly sort of jump up and say, "Oh, I'll share the domestic chores with you." No. So women have suddenly found themselves trapped at home, doing multiple jobs, and often also, for unfortunately a very significant proportion of women facing violent husbands. So the astonishing increase of gender-based violence in the pandemic, which we know is a very significant risk factor for depression and substance abuse, and suicide, has grown. And the final group is frontline workers. And by frontline workers, I don't only mean health workers, I also mean those essential workers who have had to drive buses, public buses, public transportation, clean our streets. They haven't had the luxury to go remote working. Not only has that put them at much higher risk of exposure to COVID, and we can see the results of that in Britain, for example, in the US, for example. But of course, the anxiety levels of going to work when everyone else is sitting at home obviously also will have an impact on their mental health. So I think we must acknowledge that it isn't the wealthy, the elite, those of us who can complain about, "Oh, I'm missing my friends," and doing remote learning, who are the highest risk. It's the young people, it's women, particularly low-income women, and more generally low-income frontline workers, who we should be most concerned about in terms of their mental health.
Yeah, I didn't know the scale of the disparities surrounding those three groups, and that's obviously incredibly concerning to hear about. And I think it's hard when hearing those statistics, at least for me personally, because it's like you hear that on an abstract level, but you wonder what can I do on the day-to-day to help those around me who may be struggling with these issues and may fall into one or more of these groups. And I actually want to ask you both that exact question. What can we do in these times to help create some sort of ecosystems of support, with those that are close to us, even though, we can't get together like normal and et cetera.
So I think, Vidal, what we can probably do is we could take time to check in with our friends and carve out some time to invest more in those relationships. So what I've started to do in looking after my own mental health is reaching out to folks that I often don't reach out to because my life is so busy, and making sure that I carve some time over the weekend and outside of work hours to really wind down a bit, and to take time out to invest in those relationships. I've also, on a personal level, started to go on more frequent and longer walks with my partner, and that's been a tremendous help for my own mental health.
Mm.
Yeah, well, I think Josh has described actually very important techniques of helping yourself, and I think I think the one that I want to really emphasize is helping others. There is a very powerful science, and this might sound like platitudes, but it isn't. It is actually grounded in science, which is the science of compassion, the science of caring for others, of being engaged in purposeful, meaningful activities. We often think of that as charity. We often think that you're doing good to others. But Vidal, here's the thing: you're the biggest beneficiaries yourself. The wonderful long-term life expectancy cohort studies, which actually have collected information on individuals about the level of engagement they have with the communities around them, have shown without any doubt that the more engaged you are in purposeful and meaningful activities, the longer you live. Not only the longer do you live, but the longer you live happy lives, healthy lives. So let's be very clear. Reaching out to others is not charity. It's actually doing good for yourself. Oh, and by the way, you're also helping others. There's a bunch of other things you can also do. I mean, certainly in addition to exercise and so on, I think there's a lot of evidence on the backing meditative practices. And by meditation, I'm not promoting one kind of meditation versus other, because they all really do the same thing. What they really do is essentially turn your mind to your inner stimuli, whether it's your breathing or some other bodily sensation, and therefore really concentrate your sensory experiences to the inner world rather than the ones that come from outside. That's why almost all meditation techniques ask you to close your eyes, find a quiet space, sit comfortably, etc. It's just to minimize the distractions. And it's got a very strong physiological basis. And one of the things that we want to do in Empower is also to help both the health workers learn these meditative techniques in a secular way. And in fact, the app that Josh spoke to actually does have those sorts of techniques, which are really based on mindfulness, which is a form of meditative technique, but also to teach people in the community who are distressed how to learn those techniques and apply them in their daily lives.
That's really interesting. And I picking up on this, because I know that, Josh specifically talked about some specific things that he's doing. Vikram, I'm curious, are those, the meditation or the reaching out, are those some specific things that you're doing? Or are there other things that you found helpful for yourself?
Yeah, well, I certainly do the exercise, but I swim, which of course has been problematic with the pandemic because swimming pools were closed. Thankfully, at least where I am right now in India, they've reopened. So I started walking, but I'll tell you what I've really enjoyed doing in this period. Obviously, being with my family has been a bonus. We're all locked down, we're not traveling. I've suddenly found myself having heaps more time because I'm not on a plane or a train going to work, and it's been a very positive development. But the thing I've really loved is that I have a dog in the house. She came to our household about a year before the pandemic, and we've just got on really well together. And I've discovered the joys of the dog, and walking her, spending time with her, taking her to the beach. Luckily, I live in a place which has got a very nice seafront. So those have been the small pleasures. But again, I want to stress, Vidal, people like us are incredibly lucky. That we are actually able to pivot with a little bit of initial turmoil, with a little bit of initial distress. There's no question. I also remember being very distressed when the lockdown happened. But God knows, actually, I've turned this around thanks to all the scaffolding that is around me into something that's become a positive life experience. And I just want to end by saying, we often talk of resilience as a very powerful concept in mental health. And we often think that resilience is something about just you. Somehow it's all up to you to bounce back. Look at Vikram. He bounced back. Look at him. He's doing so much. Why aren't you actually doing something like him? I think that's a very false narrative. I think we have to recognize that resilience is more in the social environment, in your opportunities, your life
Mm,
chances. And I've had the best, and therefore I was able to bounce back very quickly.
mm, mm. That's really wonderful to hear. And I think, a common theme I'm seeing, or two common themes, is one, again, that ecosystem of support and, of how, none of us can really get through this period together. It's all of us working together, supporting one another, to help us get through this period and form not only, necessarily only an ecosystem of support, but, maybe as this term using resilience, an ecosystem of resilience, how we can continue, even on those darkest days, reach out and nurture each other. And I think, hitting on Josh's first remark about this, the idea that, each of us are dealing with the pandemic in different ways. And so each of us are going to have different solutions, with how to process what's going on and get through it. But I think definitely that common theme of connecting with those you love and those that are close around you is a really, really good nugget to take from this conversation. So I actually want to go a bit broader now and just ask, looking forward, outside of COVID, outside of Empower, what are the biggest barriers to realizing mental health for all, and how can we overcome them?
So, Vidal, I think to this one, in addition to having too few providers and limited access, what's probably some of the biggest challenges in mental health care are what we talk about at CoHealth as the four big challenges to mental health for all. So there's a fragmentation of services, there's a lack of evidence-based quality care. Thirdly, there's issues related to privacy and trust amongst those receiving care, especially for those who feel stigmatized. And
Mm,
finally, a lack of personalization. So we need to think about how we're able to overcome these challenges. And I think we need solutions that are, one, in response to those four challenges, they need to be integrated. So we need to move from isolated tools to a comprehensive care platform or platforms that work across the entire mental health care pathway, from prevention to assessment and treatment to monitoring to prediction and preemption. And then we need to make sure that the treatments that we're providing are effective. And by that, I mean they need to be evidence-based, but they also need to be engaging, drawing on the best of science and the best of academia, but also industry and design. And thirdly, we need solutions to be safe. And if they're digital, they need to protect the user's privacy. And finally, we need to create treatments or solutions designed with the user, so not just with the user in mind, but they need to be actively involved and consulted during the process. And we need to be able to find them where they are, when they need care, and connect them with the right type of care at that time. And so what we're doing with Empower and CoHealth is really trying to develop solutions to address these challenges, solutions that are integrated and comprehensive. And hopefully by bringing them together, we can start to create that ecosystem of care that you referred to, Vidal, to help bend the curve of morbidity and mortality, which we know is on the rise.
mm, mm,
Yeah, well, again, I won't repeat what Josh has said, just agree with everything he just said, but I wanted to maybe give a conceptual picture of where I think we need to go. Let's be honest, Vidal. Even before the pandemic, the mental health care systems in most countries were overstretched, were broken, were underperforming.
mm,
Let's not for a moment think that the pandemic has actually created the crisis we're in. No, the crisis already existed. What the pandemic has done, it's a portal really for us to view the dysfunctional nature of the mental health care system in almost every country of the world. And so I would start by saying that the fixing of this mental health care system isn't just a matter of putting more money into business as usual. It's actually about totally reimagining and transforming what mental health care looks like. And I can think of a few very critical ways in which mental health care needs to be reimagined. The first and most important one is we need to move away from narrow biomedical diagnosis and drug-driven models of mental health care,
mm,
simply because psychological treatments have historically been very hard to access. De facto, for most people, mental health care has meant getting a prescription, even though actually psychological treatments are often not only better than, but actually have better long-term outcomes than medication. Even though people don't even necessarily want the medication, they don't have a choice. I think this whole dominance of a very narrow brain chemical kind of model of mental illness, requiring an MD, a diagnosis to get reimbursed, the whole thing is an edifice that actually has become in itself one of the most important barriers to mental health care. And what Empower is doing is building the foundation of a community-facing mental health care system that eschews the need for a diagnostic evaluation, that eschews the need for medication as your first port of call, but instead offers to people who are distressed low-intensity psychological treatments that are actually built on scientific evidence. So that's a very important conceptual shift that I think we need to engage with. The other point that Josh said, and I really want to say it again because I want to amplify it, is the importance of a person-centered approach to care. It isn't the case that people with mental health problems simply want their diagnosis treated. No, actually, most individuals have coexisting social difficulties. And to treat the clinical experiences of mental health problems as if this can be separated from the social suffering that so many individuals experience is to treat only half the problem. It's like treating tuberculosis by only treating the cough, but not the bacterium that caused the cough. It's really kind of a unidimensional way of treating mental health problems. And again, the Empower approach, and particularly with the Wellbeing Trust, what we're really hoping to do is to work with community-based organizations that can explore how can the psychological treatments or interventions for the mental health symptoms be married with the social work interventions that actually address the social determinants of mental health that typically coexist.
Yeah, I mean, I agree with both of you that, mental health is this incredibly interdisciplinary, possibly even adisciplinary problem that crosses really all facets of the way that we like to categorize, knowledge and problems. And so equally, it sounds like our solution needs to be equally adisciplinary and innovative in that regard. I just wanted to open up, are there any final closing words or remarks that either of you would like to say?
Yeah, so I would just close by saying that while the consequences of COVID on our mental health or the mental health of our communities have been severe, as we've spoken about, and there's a genuine cause for concern, I also want to finish by saying that I've never felt more optimistic about the future of mental health care. I haven't been in this space as long as Vikram has been, but it's certainly over 12 years, I've really seen all the lights turn on to pave the way for innovation like never before. So individuals are way more aware of mental health challenges than ever before, and this is across countries, and mental illness is far less stigmatized. Private and public sector funding is flowing into the space to fuel innovation at an astonishing rate. Governments and international organizations are working together and taking action. And digital health companies are creating products that are shown to be effective and engaging. And more people are seeking out help and getting access to effective treatments, and they're able to get access to effective treatments. And in the case of Empower, innovation in mental health treatment science means that we finally got a real shot at growing the mental health workforce to meet the growing demand. I could go on, but the point is, with all the activity in the space, the future of mental health care, in the words of It Gets Brighter, to me, the future of mental health care is brighter than ever before.
Thanks, Josh. You certainly lifted my spirits. All I want to say is two things, actually. The first thing is I think Empower is a terrific example of how science can be put to good use. The science in this case is not only the science of the effective delivery of these interventions, but let's give due credit to the incredible long history of psychological science, which to me is the foundational science of mental health. And I think the psychological treatments we're talking about could not have come about without that long history of psychological science itself. There's the implementation science that we discussed earlier, and there's digital science, the way that technologies can be used to enable and empower people to perform the tasks that they have historically struggled to actually get done. In this case, is to learn at their own convenience and then also be supported and supervised in a way that is engaging and also empowering. Second thing I want to say is, our journey has just begun, Vidal. The pandemic last year really put a spoke in the wheels because, we were just about to actually hit the ground running. And, in effect, we've used the year in very productive ways, but clearly we're not where we wanted to be at this time. And you know, everything's been pushed forward by 6 to 8 months. But I wanted to say we're a small team. We're a growing team of collaborators and you know, members from around different communities, different sectors who are working with us. But we have an open door policy, and we are very, very keen to partner with members of the Rhodes community and beyond who are passionate about mental health, but also passionate about innovation, about scale up. If you think there is something you have to offer, something you can contribute in any way to empower, please just write to Josh and I. And I'm sure we would love to hear from you.
Wonderful. And yeah, I think, you know, to that, you know, given the reflections on this pandemic and stuff, I'm actually thinking of going into this space as well, you know, at least in an academic setting in the next stage of my training. And, you know, having both of you guys at the helm, you know, leading the charge and, you know, painting that vision for, you know, the bright future in this space is really encouraging for me personally. So thank you both for that. I honestly don't think we have much more to add to that. So I just want to finish up by saying thank you everybody for joining us on another edition of Roads Ahead. And as Vikram and Josh alluded to, you know, we'd be happy to connect with you moving forward.
Thank you very much.
Thank you, Vidal.